to continue. All right. Thank y'all for letting us know you couldn't hear. If you have any other problems, please let us know. But like I was saying, these techniques were life-changing for my own child. So, and it's kind of like a window to help him overcome his challenges. And today he has no recollection of the challenges that he had when he was younger, and he does not have anxiety. He's not on medication. We're living a nice functional life and doing great in high school. So that's what I want for all of your children or the children that you work with. So that's just our goal, and that's what fuels my passion to want to just share this with the world. So that's why we're here today. Okay, with that, we'll go into, I'll tell you all about Pediatric Therapy Solutions. Isn't it anybody's first time here? It is, okay. So I'll just tell y'all just a little bit about us. We're at Pediatric Therapy Solutions. We're an outpatient therapy clinic. We offer occupational, physical, speech therapy to children of all ages, and we also service some adults. Our occupational therapists work with the mental health side of things, calming adults, really, anxiety, ADD, post-traumatic stress challenges and things of that nature, sensory processing disorders as well. We also have a therapeutic preschool, and that's unique. That's something that I developed after my experience with my own child. I had developed a 30-page home program for him whenever he was 2 and 3, and I would make sure to do that with him every day, and that was instrumental in his progression. And so I was like, wow, I wish every child could have this opportunity. And so about 7 years ago, we opened so what we call a PAL program, play and learn program. So, and it was at first led by occupational therapists. So we would do basically my child's home program, but cater it to all the kids for 3 hours a day, as many times as they would come. And then we eventually transferred it or transitioned it into a preschool. And so that's our therapeutic preschool. All right, now with that, we'll go into our how to calm our kids naturally. Okay, so let's find out about you guys a little bit. So how many of you guys are parents of children with challenges? Okay, good deal. Now, let me get a feel for, let's get a feel for the ages of your kids. So how many have kids that are 5 and under? Okay, great. And then 10 and older, anybody? Okay, great. How old is your child?
Well, I have 3 kids,
Okay.
6, 10, and 14.
Okay, great.
And I guess I came for all of them, but more specifically for the 10-year-old.
Okay.
It's just has a lot of problems with emotional regulation and kind of dealing with anger and her feelings.
Okay, good. Okay, we can help with that. So would anybody else like to share anything about your kids or what you'd hope to get out of this presentation? Okay, all right. Well, with that, we'll go on into it. So when I have a child, when I'm working with a child who is dysregulated or upset, they may be getting too much stimulation from the environment. Okay, that's the first thing that I consider. And when you're getting too much stimulation from the environment, it can cause you to become frustrated, even hyperactive, having meltdowns. When this happens, a child's brain is in stress, and when your brain is in stress, you have very little potential for new learning to occur. So the first thing that I do is something that's fairly, easy to do whenever you have a child that's dysregulated is consider the environment, consider the 5 senses, okay? The child is likely overstimulated, so how can we decrease that stimulation? Okay, so I'll take you through all of the senses that we're going to consider and give you some examples of things that you might want to consider. Okay, so first just vision, okay? So a very visually stimulating environment can be irritating to a child, even if they don't realize it and can't verbalize it. It can just help them to cause them to become overwhelmed pretty easily. So I try to, that's why our therapy rooms, like all of our therapists have individual therapy rooms. We keep them as boring as possible. We don't have a lot of things on the walls. We keep all the toys in our cabinet, so that we pull one thing out at a time. Because if you go into a room, this really is typically our gym, our sensory gym. And so this is the only room that's really like Disney World for the kids, so they can just run around and have a great time. But then we pull them in our treatment rooms and get our work done. So I would say take them to a room that is not a lot of things on the wall, not a lot of movement. If there's a TV on, get that TV off. You can dim the lights or even turn off the lights and open a window. Natural lighting tends to be less or more soothing than artificial light. Fluorescent lighting in particular can be very agitating if a child has to sit in a room with fluorescent lighting for a long time. Anything to add about that, Kaci?
I think just being cautious too with eye contact, like that, we don't often consider that to be like a visual cue too. But the more we're trying to get a kid to like visually focus on something, we need to be mindful of our body language and our posture and things like that. So not forcing the eye contact, also kind of making yourself small. So you're not this big looming visual presence, kind of getting down on the kid's level and things like that can really take away and help them hone in on you to kind of model that calm environment and things like that.
That's a great point. And also there's a universal body posture. That means I mean no harm. Okay,
Mhm.
so even nonverbal children can interpret this. And you put your hands like this, you uncross your arms, you put your hand like this, and you get small and kind of put your head a little bit to the side. Okay, right? Studies have been done on this, so it's kind of interesting. And if you're in the presence of your child and they're upset, try not to look upset yourself. If they look at their parents, they model off of that. Try not to let them know that you're getting upset as well. Okay, moving on. Hearing, the auditory aspect of it is huge, and this one is frequently can cause meltdowns, and I think it's frequently overlooked. When a child is agitated, the first thing that I do is I stop talking. I just stop talking and just try to assess the situation. And why is this child dysregulated? Oftentimes it's too much auditory input. So even if your child is arguing with you, no, I'm not doing this, or I don't want to do this, or this is dumb, or whatever they might be saying, don't argue back. You just stay quiet while they're having their meltdown. We'll have time for talking later. If you have to say something because they're being unsafe, say it in a whisper, or just, that type of thing. Let's see, we want to turn off the TVs. We want to turn off, if there's music in the background, the phone, just any kind of external noise we want to decrease. If you're in a noisy room, take them to a room that's quieter. Fluorescent lights are agitating. God bless you. Fluorescent lights are agitating to some kids. So just the sound of it. So we don't have any fluorescent lights in this building. So I built it in 2020, and all the lights have dimmers and no fluorescent lights, and that's for a purpose because we don't want to agitate kids. Let's see. Some children are bothered by the sound of the air conditioner. As we've had several children, that's our nonverbal kids, and it's hard. It's hard for parents to figure that out. But sometimes, like when the air conditioner comes on, it's like it either hurts their ears or the sound of it. Something about the air conditioner just can really agitate certain children. Anything to add to that?
I think just also thinking about sometimes when you can modify the environment, sometimes just soothing, very calming or quiet music, something that's kind of an even tone, classical music, that kind of thing. We use instrumental music sometimes a lot. That's just kind of very slow and regulating to the child. So as they're kind of getting to that calm state, or if we're trying to kind of tune out a very noisy environment, if we can't get them to an area that has no extra noise, how can we kind of modify the noise in the environment? And then also considering for some kids, things like headphones can be beneficial and things like that. But sometimes if I have a little one that I feel like is really overwhelmed by the noise, I just kind of use my hands and model, maybe I want to cover my ears, and then they'll kind of try it themselves. And then they realize, okay, it's a little better. There's not so much going on, as much input and things like that. So
Good point. All right, moving on. Another one that we look at is a sense of touch. Our skin is the largest organ in the body. So it's very important. If the brain is not processing the sense of touch correctly, it can cause all kinds of challenges. It can cause us to just be easily irritated. It can cause us to become hyperactive, have meltdowns pretty easily. Okay, and this is maybe something that people aren't even aware that they have this challenge, right? So what do we do about it? So deep pressure touch tends to be more calming than light pressure touch, okay? So you can, if you have a child that's agitated and they allow it, you can just give simple deep pressure to their shoulders. So just kind of like this, sitting and just giving a little bit of deep pressure to her shoulders. And I'm actually pressing down, just kind of giving sweet, like a, I'm not digging in, but just doing that type of motion to her shoulders while giving pressure down. And it just kind of helps the child to know where they are in space. You can feel your body from here to the chair, and it tends to have a calming effect. Any of the exercises that we show you guys, if for some reason you're doing with a child or an adult or whoever you're doing them with, if they are not calming, if they're not receiving them well, then stop immediately. Okay, that means there's a challenge, and everybody, it's not black and white. Everybody's different. So I just don't know if I said that. I wanted to say that one. But yeah, deep pressure can definitely be calming. In therapy, we use weighted blankets a lot. Like we'll have a weighted blanket in every therapy room, in every treatment room. Our kids gravitate to them. They love to go and get them. They just sit on. Oh, it's so calming and relaxing just to have the weight of a therapy blanket on the child. So that's another thing that we use.
yeah, just simple things to consider, like clothing and temperature and things like that. Kids in a sweatshirt, it might be a little hot, might be a little cold, that kind of thing. But also, being mindful of if you have them in an environment that may be unfamiliar and they're sitting on something that's fuzzy or itchy, maybe that's just what's irritating them. The chair might be a little too hard, that kind of thing. So all those things, anything that we experience on our skin is considered something affecting our sense of touch and our tactile system. All of that can, every person registers it differently. So any of those things can be contributing to that stress response.
All right, and moving on, the next sense that we can talk about is the sense of smell. And some children are particularly sensitive to different smells. So we use essential oils in therapy for our kids, that can tolerate them. And certain essential oils, like we only use the doTERRA brand because it is 100% natural. So we're real particular about the ones that we use to make sure that they're completely safe. So certain smells can elicit calmness, and certain smells can elicit alertness. So there's lavender that we use, one called Serenity. It's an oil blend by doTERRA that we'll put those into the diffusers, and those are just very nice and calming and relaxing. We don't do this in therapy, but I do this at home, and I've done this with my own children. So we never put oils on kids, but I have a little thing of lavender oil by my bed. put on my pillow in the evenings, and I just go straight to bed at night. So, and I've done that with my children. I'd even put a little bit of oil on the bottom of their feet. So, and that kind of helps them to feel nice and calm. So do that at your own discretion with your own children if you'd like. And we have diffusers in here today. We have an oil blend. Oh no, let's see. Oh yeah, an oil blend called Breathe. I do use that one a lot. It's very nice and relaxing. Kind of has a little bit of peppermint in it with tangerine, which is really nice and alerting. So that we can all stay focused and learn today.
The only other thing I consider too is being mindful of personal care products. That I think is something we often forget. It's real nice to go shopping and get the fancy smelling perfume because your husband likes it. But if your kid is really sensitive to smells, that could be something that triggers them, very quickly. And so considering things like our shampoos, our deodorants, laundry detergent, if they're having trouble going to bed at night, sometimes the detergent we're using can be a little overstimulated to their sense of smell. And so just kind of considering all those things in the environment that for us, we may not notice, but these may be things that are triggering to your child and their sensory responses.
That's a very good point. And I'll just say, changing from a scented detergent to an unscented detergent for my family was very, it was very helpful. So we wash all of our sheets. I have both of them because I love the way it smells. Yeah. But it works out a lot better if we just have the unscented. Whenever I wash our sheets with the scented ones, we're all sniffling. We're all just like it elicits some type of inflammation in our bodies. So I wash all of our sheets with the unscented, and it makes the world of difference. So. All right, moving on, we will talk about the sense of taste. Okay, that's something you can think about. Basically, foods that take a lot of effort to eat, but yet we enjoy them. These are the foods that will have a calming impact on us. Okay, so chewy foods, crunchy foods, they can be calming. Consider if a child is agitated and they're not fully verbal or can't express things. For the younger kids, consider that they're hungry, they're thirsty. I know when my kids were little, if they're getting a little angry, oh, here's food, here's water, here's some water. Let's rule that out first, because if that's what it is, then that's great. That's a relatively easy fix, right? So we want to make sure that they have regular food intake, and just drinking water, healthy beverages can have a positive impact on a child's mood. Just don't rule that out. So if you use a straw, using a straw can have a greater calming impact on kids because they have to work to suck the water. Let's see. Yeah. Anything else? Anything to say? Okay. Yeah. Wonderful. All right. So regarding the senses, every child is unique. So, you just have to look at your own child and try the different things and see what might work for them. Any questions about that? All right. Okay. Going on. Can y'all still hear us? Hoping they can. If you can't, let us know.
Yes, ma'am. I can hear you.
All right, we're going to move on to some exercises, okay? Like I said, this is an interactive workshop, so I'd love for y'all to work on each other if it's within your comfort zone to do so. And if you're watching at home, just kind of watch our techniques. If they have anybody else that you're watching with, practice on that person. Some of them you can practice on yourself as well. Okay, so the first few exercises I'm going to show you are taken from courses that we've taken that are called neurotactile integration. It's part of the TOVA method. We're going to talk about that in a little while, but they help to regulate our tactile system or our sense of touch. Like I was saying earlier, the skin is the largest organ in the body. Okay, so that's the easiest way that we can get stressed without realizing it, right? So our therapists, our Kaci and I, and the therapists at PTS have advanced training in this particular technique are these techniques that just help to help the brain to send better messages to the body with regards to the sense of touch. And what that does is that then takes the brain out of a state of fight or flight, helps to calm the brain. When the brain is calm, the higher level parts of the brain, that frontal part of that brain perks up and it opens up, and then it's ready for and to take in, more information. It's ready to work for reasoning and higher functioning things. So with that, we will go, we'll need a volunteer.
Come on, Jim.
Go, Ms. Kaci. I take you off this first. And Kaci will show you how to do this first.
So the first one is one that I often teach to parents very early on because it's a very easy technique, very calming technique. It's something called embracing squeezes. So technique wise, you're going to just kind of cup your hands into a little C shape. And just depending on the size of the child, if you have a little toddler, you may only need to use one hand for this. But on our teens, our older kids, and our adults, we're going to use the little two-hand method. And we're just going to be doing a light pressure, with like 1 to 2 pounds of pressure, and we can walk around and show you guys what that kind of feels like. It's not a squeezing or anything like that, nothing too heavy. But we're going to work on the arms. You can also do these on the legs. I'll demonstrate on Kayla's arm today. And the technique as we apply it, we're going to work from the wrist, above the hand, up toward the shoulder. Okay, so I'm going to show you guys. So just so I'm not blocking her. But you're just gonna bring your hands right around, nice calming, regulating energy from you, and you're gonna hold for about 7 seconds. And then you just bring your hands up the same distance that you just held, you're just scooting up a little more. And you can relax on the legs so you're not can't super too. You're just gonna work right on up the arm like this. And then as I get toward the shoulder, I just kind of stay away from that tickly armpit area, and I just kind of work on the outside. And after I get to that last point, what I like to do is just place my hand down at her wrist. I'm gonna do a nice stroke along the entirety of her arm and just give a little stretch to the whole. That'll be okay. Very good. Perfect. All right, so if you guys want to, if you want to partner up, if you're comfortable doing that, you can try on yourself or with somebody next to you. And Danielle and I can kind of walk around too and just demonstrate on you guys as well. Just kind of give it a little try and ask us if you have any questions, okay?
Shall I try out to do that on y'all? Or shall I try to?
Yes.
Are you sure? You just kind of try, and you'll just keep having teenagers too, in between.
You're gonna do this, you can do this today. Yes, yes. Maybe watching a little show. When I'm pressure, they're just sitting down for the Saturday. You can do it with the lettuce and I'm trying to say I just like it. And I'm happy that you can like 3 to 5 times going up there on it. One time is fine, but if you do it, It just, the food. It's the perks of this trip. It's a stage. It's different. Would you like me to start?
Yeah. So like. Like, if you come in first, you wait and I have to touch. Real fully, he's not really interested. Right.
I'm going to say GPS on that, and which is to firm up.
But not, you know, right, and not like sudden, you know, nature is, when you come, you know where you're going versus kind of trying to find right. I would say, like, it's not one distance, so we all get it right first. It also doesn't touch it, getting that nervous system. It's not right. It's weird, very weird. I've never looked at someone. At least that was the right. What you do. After said, I'm sorry, all that. Yeah. You got to ride. And it's part of a bonding, right? You're a child, because there's something that you can do. Yeah. Even if you don't do it. Yeah. And yeah.
Yes, we just need the introduction. We just got at the beginning. So towards the end. Yeah.
Child relationship.
Yeah, the introduction.
My introduction or theirs. Oh, well. Sure. And we had a good question on this to share with you guys too. This is embracing squeezes, and this is from neurotactile integration. So nervous system, tactile system, or sense of touch, we're putting them together. But the question was like, if you have a kid kind of pulling away as this action is happening, what do we do? Do we stop there? Yes, that's a little stress sign. So just kind of give them a second, kind of stay calm with them. Usually if they're pulling away from that touch, I would go back to like Danielle did earlier with just the light touch on the shoulders, kind of grounding pressure there. And then just kind of try again in a little bit. And just being mindful when you come in to do the technique. We don't want to be kind of like dancing around and where do I touch? We want to be really intentional. Okay, so that it's organized and intentional. Any questions? Any other questions you guys have about that one? Everybody feeling a little more relaxed now? Yes. Good.
Right, we need a volunteer for the next one. Come up, Miss Maria.
This one is called rotations of the joints of the body. So that's what we're going to be doing. We're going to be working from the distal, so like the farthest part of your body, and we're going to be working up to the shoulders. So what we're going to be doing is we're going to be doing little rotations. Okay. So when we do the rotations, we're going to do the rotations. We always do the rotations in the direction of the midline first. So we're always going to do the rotations up and towards her nose. And then we're going to do them up and away from her nose. Okay, so for this one, we're going to do 3 rotations. So 3 rotations one way and then 3 rotations the other way. We're going to start, you can do them with individual fingers, but we're just going to start with doing all the fingers. So we're going to start with doing rotations, this joint of the fingers, and then the wrist, the elbow, and then finally the shoulder. So, and then after I finish doing that, I always do, I cut my fingers like a C, and I go down the arm and give a little traction at the end. So I wanted to explain it because I don't like to talk a whole lot while I'm doing it, so she can actually enjoy it and just relax. So with that, I'll show y'all. Okay, you can just relax your arms. 1, 2, 3, and then back. 1, 2, 3. So I'm holding this way, like on each side of the joint that I'm moving. And then I'm going to do her all separately. 1, 2, 3 towards midline, and then away. 1, 2. Okay. Now I'm going to do the wrist. Okay. So 1, 2, 3. And start and stop in the same place, which is 12 o'clock. And then back the other way. 1, 2, 3. And stop. And then I'm gonna support her arm. She can just have a flaccid arm is fine. I'm gonna support in front of and behind the shoulder, the elbow joint. Okay. 1, 2, 3. And then back the other way. 1, 2, 3. Okay. Now we'll leave her shoulder. I'm gonna support the entire arm. 1, 2, 3. And then we have 1, 2, 3. And then I'm going to take my arm, my hands like a C, and put starting at her shoulder. Come on down. And again, just a little tug, or it's called traction, right there, right, holding right above the wrist.
It's really nice.
It's amazing. All right, any questions about that? All right, well, let's take a few minutes and everybody can practice. Yeah, absolutely. Y'all practice on each other. I'm gonna practice. Yeah.
Individual fingers. Or you can do kind of the whole, or your 4 long fingers together. And it's just stop at the top of the symbol. And we're gonna go the other direction.
I love being patient. People practice on like, oh, it's fine.
It's like, we get excited, we work on each other.
Which you, honestly, we all do this.
You follow in order.
You can do it never. You don't have to know. Okay. Whatever you can get. So you they're not staying still.
Yeah.
You can get it all. So the first one, I really asked you to do it with both of the situation that you stress for your child. So, I was like,
birthday parties and having a environment. One is what about so tests and their school is at these times use that's for times. It doesn't matter where you use it. You can use it as a preparatory method to kind of just get stuff in the system and ahead of time. Or if you kind of see that you say, yeah. And it always just kind of depends on the child's tolerance. Some kids don't want to touch your side. You know, you might have to use the sensory strategies first, you know, kind of a little bit more calm and regulated, but then come in with this. And that's the way it kind of reset the nervous system for them to proceed forward. I think that's also. Yes, yeah, absolutely. Yeah. Before getting in there. And a lot of them, like with our older kids, just kind of depending on the level of kids and things like that too. There's techniques we teach that will show the kids how to do it with themselves. So sometimes if they have a fidget kid or something like that, it's nervous, they might do a little bit of a short rotation themselves. Just so that we get here and stuff. Same thing, individual fingers and things like that. And then all the techniques we're showing from neurotactile we're doing on the upper extremity just with access. You can do these on the toes as well. So toes, ankles, knees, even hips, just, kind of depending on how solid they are.
That's so that is the way you feel. So if you like nails.
Yes, yes, that's like, absolutely. And the next one we're going to show is actually really good ones. Some of that nervous bouncing and so things like this. I find sometimes too, we end up kind of like doing to ourselves and not even realizing it's like calming because you have a little sleep to yourself and it's just after the next one we're going to show is kind of that just picking it like. You guys have any questions about that? You're welcome. My name shows everybody, so I'm sure. So that's what you said. I'm just like, so not for us in our time. Like, this actually, it wasn't hard. I tried so hard. Sometimes men just don't get it. But even, it just was with friends or just, and it's a really big cool accident for life. And his brothers went with sometime when I felt right. And this is, I just noticed you want to take words when I'm home. People things like that. So it's like right across the line. Absolutely. More involved.
And they used to, actually, this is kind of, used to be one of the programs they offered through early steps in the beginning.
Yeah.
Because it was good for infants.
Yes, absolutely. Yeah, there's nobody too small or too large for these techniques that we're doing. And honestly, these neurotactile exercises with the program and the research that Dr. Maskatova has done working in the NICU and with premature babies. And I mean, immediately after birth, kids don't have to have, stress or trauma that we're aware of. Birth in itself is a traumatic enough process. So doing this with newborns straight out of the womb, super, super beneficial to just kind of regulate that nervous system. Absolutely. So any other questions about the rotations of the joints? All good? Okay. All right. So the next little technique that we're going to talk about is something that we call finger crawls. So do we have any final volunteer for this little section? Perfect. So this little technique is one that I find I tend to do to myself pretty frequently without even realizing it, just as a calming strategy. And then I was like, oh, wait, this makes sense. It's calming my nervous system. Here's the why. And so what you're going to do, you can work on the fingers as well as the toes for this one. Fingers are obviously the easier access, and you'll start with the thumb and then work toward the pinkies. And you basically are just taking your fingers. I usually use 3 fingers if they're teeny tiny, maybe 2. But you want to kind of create, I don't know, like a little caterpillar that's going to crawl right up the fingers from the tip toward the base. Okay. Just real slowly and intentionally, and then you just pull away. Okay, so starting at the ends, working toward the hand. Since I'm going a little fast on myself, what I'm doing with kids and with Miss Ashley, I'm gonna slow down a little bit. So I was mentioning this one is really great for our kids who are either fidgety with their hands when they're nervous, are skin pickers and nail biters and things like that. Redirecting input to those fingers with these little finger crawls is really powerful. And this is an easy one to teach to kids from very little all the way to our teens and adults. I'll show you guys what this looks like with this one. Just slide over. And again, it's just real intentional touch like we talked about. And you want to try to cover as much of the surface of the fingers as you can. And that's it for our finger crawls. If you guys want to practice on yourselves or your neighbor, you're really regulating. I'll try it out.
I used to do this with my children in church.
Yes, yes, absolutely.
Like that. They would just be sitting next to me and I'd be sitting next to them and I would.
This is not obligation, take it, we currently are. Yeah.
Church.
It's like that one's like some whole snakes especially. Like I'll have to go to the kid and try it and they're like, oh yeah, and they just get like hyper focused on it and it's not anything special. It just.
And then we can be looking when you just ask them, their head in your lap and
Teeny tiny fingers.
you can get something that you can like demonstrate it, you know,
And they watch me and they'll say,
To be like, I'm just trying to deal with that anxiety seeing me really move.
yeah.
And then they're kind of. Have a little bit more. Would you like for me to try that? Okay.
Feel the pressure.
What's that?
We had a couple of questions about like when's the best time to do these? Before bedtime as the kid's kind of getting regulated and reset for the night. But I also like these techniques in preparation for stressful activities. It doesn't have to just be once we've reached that meltdown mode or if we're seeing that, that state of stress kind of increase. But if you know your kid has trouble in large settings or in church or birthday parties, test anxiety, the doctor's office, absolutely, yes, for medical appointments, anything like that, going to new places, yeah. Any of that, these techniques are really great to kind of prepare the nervous system and kind of get it ready for that big change. And the other beautiful thing about this is the sense of touch is the most natural, thing we experience. We're not using any fancy tools or anything like that, so it's easily accessible. But there's also, we can't do harm by doing these. So if you feel like, oh, I already did this 3 times today, I can't do it again, that's not the case. If you need to utilize it a little more, use it a little more. There's not too much, you know, the nervous system just, it lacks it.
Our clinic is unique in that our occupational therapists are trained in something called reflex integration work. So, and I stumbled upon reflex integration work many years ago when I was trying to help my son. And so that's one of the things that was instrumental in helping him come out of his world and back into our world. It was kind of like a little window, if I could explain it that way. So he was in his own world and we couldn't get him out. Well, then reflex integration work that opened a little window so that we could slowly but surely help him crawl through that window. And boom, and here he is. So, so we're going to show you a couple of examples of reflexes and then show you a couple of little things with that, little exercises. But I want to explain to you what reflexes are and why they're important. So as humans, we are all born with a set of reflexes. Some of them are only present when we're infants. Some are necessary for birth and delivery. Some reflexes are present throughout our life. But a lot of them are only supposed to be present when we're infants, and then they're supposed to integrate, which means like they no longer appear as we, you know, get a little bit older, so, or whenever they're not needed. Sometimes whenever stress occurs, like it could be a child was in a car accident, it could be, you know, just some type of a traumatic birth, it could be a traumatic instance after birth. It's hard to say for each person exactly what can cause it, but for some reason, reflexes that should be integrated or should start to go away at certain periods of time do not go away, and they continue to appear at age inappropriate times, like past the time whenever they're supposed to be appearing. So whenever that happens, it causes a block in development with relation to that reflex. So our therapists are trained in looking at a host of reflexes, over 20 of them. Every time kids come in for or adults come in for an assessment, we're automatically assessing them for over 20 different reflexes. And either the integration or the lack of integration of the reflexes gives us so much information as to what their potential challenges may be. And another thing that happens whenever your reflexes are not integrated, or certain reflexes are not integrated, is that it puts the brain on a sense of stress. Like the brain is like, hey, the body's not listening, not doing what I'm telling it to do. And Kaci's going to give us several examples of reflexes, but that brain gets stressed, and it's a subconscious thing. And that's when you see kids with anxiety, kids are having massive meltdowns and we don't know why. As adults, we just feel on edge and we don't know why. Probably our reflexes there are some reflexes that are not integrated. Okay, so with that, Kaci's going to give us some examples.
And so I'll just kind of, I'm going to go through just a couple that you probably are familiar with, just with babies that are more obvious, and we'll do some examples where we will kind of practice some reflexes. But first and foremost, I think when anybody thinks of infant reflexes, they think of the little stroke on the side of baby's mouth. You give the stroke, baby's going to turn, start sucking, look for that source of nutrition. Okay, so if I walk up to the majority of you in the room, if I stroke along the side of your cheek, you're often not going to turn and, you know, try to start rooting on my finger and things like that. Another example is just kind of that automatic grasp reflex that we know babies are born with. They kind of come out in that fisted position. If mom puts that finger there, they have that automatic closure that's there for not only learning to grasp and things like that, but also as a sense of protection. They hold on for dear life. Okay, so those are kind of some more obvious reflexes that we talk about. But I'd love for you guys, if you don't mind, to stand up with me, and we'll look at our bodies and kind of how we move a little bit and talk through a few more of these. So what I'd love for you guys to do is kind of get your feet, you know, about shoulder width apart, and we are just going to lean forward. Okay, don't go to the point of falling, but I want you to lean forward. And can somebody just shout out, what do you notice your feet doing? What are our toes doing?
Sailing or something.
Yeah.
Holding a line like.
Those toes are curling. Absolutely. Good job, you guys. Gave the right answer. Good. Okay, so the next thing that we're gonna do, we're gonna be in the same position. This time we're gonna lean back and pay mind to your feet again. Okay, also an automatic step. There's a reflex we want to remain when we need it. What are your toes doing now? Yes. Feet are coming up, okay? Yeah. So these are two reflexes that are there that we want to be present, you know, in certain times, okay? They want to help us to keep from falling. These are automatic responses. We're noticing changes in gravity and changes in our body position, and our feet are reacting. Our brain says, hey, I gotta, you know, help you there. If we were to continue leaning forward or, you know, trip like we're gonna fall, anything like that, our hands are gonna come out automatically, okay? It's a protective response, a protective reaction, an automatic reflex that we had. So you guys can have a seat if you like. Thank you for doing that too for us. I wanted to talk about the attention in the room too. Do we have one volunteer that wants to stand up and do a little bit more with that one? I want to give you guys another example from that. Come on, since you already okay. So what I want to do is we're going to go forward again, and this time I want you to pay more attention to your vision. We're going to pay attention to your senses. So when you're kind of standing here, maybe just look at the charts toward the back of the room, the little pictures, and then I want you to kind of lean forward into that position. And what do you notice about your vision? Do you feel like it's more in tune, or we?
Yeah,
Okay.
like I'm focusing more on that than like myself.
Excellent, excellent, good. Okay, now let's move back and notice. I'm so it's all that. So what are you noticing about your vision and kind of your awareness in that position?
Still focusing more on the pictures.
Yeah, okay, so you kind of tune in. Do you feel like you can see more of what's going on around you when you're forward or backward?
I would say backwards.
Okay, yeah, very good. So that forward position, when we're coming forward, we have tendon guarding reflexes and things like that. But what we're looking at is that in that position, we're more hyper focused. Okay, so our vision is more in tune. We kind of read things a little more clearly. Everything kind of going on externally around us is less important to us as what's right in front of us. So kind of our kids who are very hyper focused, perfectionist tendencies, that kind of thing, kind of in a constant state of, you know, kind of stress and things like that. They may be stuck kind of in that forward position and things like that. The opposite is true for, and they may have trouble seeing the big picture of things, okay? The opposite is true for our kids who may be, you know, kind of living in the world back here with their reflexive responses. They are constantly aware of everything that's going on. Our ability to attend and focus is not there. They're, you know, kind of constantly in that state of stress of figuring out what's a danger, what's not a danger, those kind of things. So thank you so much. Perfect. Yeah, so that, those are just two, you know, a couple of examples to just kind of show you reflexes in action. And then what we're going to do now is we're going to focus in on two reflexes that we'll talk a little more in depth about, and we'll show you guys some exercises that we can utilize to kind of quiet down those reflexive responses.
The first one that we're going to show y'all, this one, I love this one. And it's so simple. I've done it on myself before, and you can do it on yourselves whenever you get nervous or anxious. Help you to stay calm during stressful situations. And then you can also do them on your children, okay? And so we'll just practice this one on ourselves. So it's called fear paralysis. The fear paralysis reflex, there's a whole protocol for it in the Muscatova class, which I highly recommend that you guys take. Anybody with a college degree can take these Muscatova classes and just learn a world of information. So this is just a tiny glimpse into it. So this one is from the fear paralysis reflex. And so for this one, it's a series of tapping, okay? And so you tap on different points of the body for this particular reflex, but I'm going to show you guys on the sternum. So it's the bone, you know, right, your collarbone and then your sternum. So it's just the bone right your collarbones in the middle. So you put one hand there, and then you're going to take the other hand on top, and that's going to be your tapping hand, okay? And you're going to tap in a cha-cha rhythm, okay? So it's just going to go cha-cha, cha-cha-cha, okay? So you're going to do that 3 times. And I'll talk y'all through it and I'll do it, okay? So while you do it, and you'll tap in you can tap firmly if that's what feels good to you or just feels calming to you. If a child needs a lot of input, then a firmer tap is better, okay? And then so we'll do it 3 sets of the 1, 2, 1, 2, 3s, and then we'll take a deep breath and exhale, okay? It helps to regulate your heart rate, helps to decrease that startle response, okay? All right, so we'll get going. One hand here, other hand on top. We'll go 1, 2, 1, 2, 3, 1, 2, 1, 2, 3, 1, 2, 1, 2, 3. Deep breath. And exhale. Okay. So this is one that you can do on yourself. Like I said, you can do on your child. And this is for prevention, right? This is to prevent tantrums or to help them to stay calm. You can also do it on the back if you want to turn around and show you like their shoulder blade or their scapulas. What are they called? Shoulder blades. Shoulder blades. So like it's our scapula, trying to keep between the scapula. 1, 2, 2. If you have a child that's already in a distressed state, they tend to go into the fetal position. And when they're upset or stressed out, you can come behind them and do it between the shoulder blades, and it still works. So, yeah.
That was reminding me when your baby was low.
Yeah, absolutely. And it's related to like the rhythm of the mother's heart rate. And so it kind of goes back to like that was the natural rhythm that babies were first experiencing. And so that's actually why she utilizes the cha-cha-cha-cha-cha rhythm for the techniques, things like that. Absolutely.
And we teach this to a lot of older kids that have test anxiety or anxiety if they have to give a presentation in school or just different things that they're stressed out about. And then, I mean, you just kind of, we tell them, you know, if you don't want to do it in class, go to the restroom and do it, you know. And I do presentations to teachers as well. And it's one of the things I teach them. I mean, they can do it with their whole class before you do standardized testing or before you do any kind of testing. Get everybody to do a little group fear paralysis.
May or may not utilize this before we speak to you guys. There's going to be stuff.
Yeah. Questions about that?
So the next one that we're going to go through is another one that is associated with regulation. It's called the Moro reflex. Some people may have heard of this one before, but the Moro reflex is related also to kind of our startle responses when we have sudden changes in position or sudden stimulation. Oftentimes when we think of babies and, you know, parents are often taught to swaddle them after birth to kind of reduce that startle reflex, things like that. That's all related to the Moro reflex. That's the technical name for that one. And so with the Moro reflex, we know when babies are first born and in utero, they're in that fetal position. Okay, so all their core and their limbs are flexed together. And then we have passage, you know, through the birth canal if we have a vaginal birth. And then what happens is we have that extension of the neck as baby crowns and opens up. And then we see the body come out into this position. Baby takes that nice first deep breath, and then we come into that, you know, crying, return into that startle. Return to the flexion position or the flexed fetal posture. So Moro is it's one of the most essential right after birth. And oftentimes that's one of the things we can kind of trace back with our kids who have big emotional responses. One of the questions I ask is, were they breathing right after birth? You know, was there stressful? Did we have any, you know, aspiration, anything like that? Did they have trouble breathing? Did it take a minute for them to cry? Because we may see, hey, that Moro reflex didn't really kick in when we needed it to in that normal time frame of development, things like that. And so later on in life, what do we see? Our kiddos who have high anxiety, our kiddos who have big emotional responses, our kiddos who even have trouble just kind of breathing, with a typical pattern, sometimes impacting feeding and things like that. But then more functionally in day-to-day things, we look at kids who may not like swinging. They may not like their feet leaving the ground. They may be really insecure with some movements. Also our babies who don't like to be laid back when they need a diaper change, or our toddlers who can't tip their head back to have their hair washed. It sends them into immediate panic, their body's coming up. That is the moral reflex kicking in. And so we will do a little test if we have a little volunteer who want to demonstrate how we test that with kids. Anybody want to fill on up? Thanks, Kayla. Perfect. So this is an easy one that you can utilize at home if you'd like to just, look at your child's moral reflex. And oftentimes, I'll share it with a parent, and the parent goes to, oh, let me try this test. And then we see, they're kind of in that state of stress. Their reflex is still active as well. So what we're going to do, Kayla, is you're going to just leave your hands by your side. We're going to position your feet out like a duck. And then what we're going to do is we're going to walk forward toward the chairs in that duck position. Good job. And then we're going to walk backwards. Okay. Nice job. Okay, we're going to do the opposite now. We're going to do a pigeon-toed walk. So arms are going to be resting by your side now. And we're going to walk forward. Okay, was that kind of comfortable for you? I know it seems a little awkward. Did you notice anything, like, are your arms comfortable at your sides? Is your body trying to change things up?
Like I just got more like tens.
Yeah, okay. So we're looking at what does the upper body do in response to what the lower body's doing, okay? So when I have a kid get into the duck position, oftentimes this is what I say. Those hands are gonna follow, okay? And so when I get this, that tells me the body is reactive. This tells me the motor reflex is active. The opposite is true. If I get them into that pigeon position, oftentimes their little hands wanna rotate. Okay, so we're not having what we call dissociation, the ability to move only the lower body separate from the upper body. And that's just one of the active ways that we can look at the reflex. With some of our little ones that can't follow those directions, I do just kind of hold them in the lap and say, okay, let's get you back real quick and kind of see, does that reflex kick in? So very good, okay. And so I'll kind of just demonstrate a little integration exercise for you guys that you can utilize at home with your child. I call this one the starfish. And if you remember when I talked about those postures, the first one was everything kind of coming in a fetal position, and then everything moves out with Moro. So we're basically just working the child into and out of the reflex position. So you can sit on the edge of a chair. I'll do it up here on the mat. And the idea is just simply crossing the legs, crossing the arms, and kind of tucking in, engaging that core. And you hold for about 7 to 10 seconds. And then you're going to come out like the starfish. Okay, so head back, arms out, legs out. Very simple. I usually repeat that about 3 times. Another critical piece of this is just watching if a kid holds their breath when they're doing this. That's often a sign of how difficult it is and that reflex is pretty active. So we really work, the more we practice it, on good breath regulation for doing that. So if you guys want to try, you're welcome to, but it's just simple crisscross, and then we're going to open up into the starfish and then try to alternate the next time the leg and arm that are on.
Does this help with low muscle tone?
What's that?
Does this help with low muscle tone?
It absolutely can. Yes, absolutely. Because oftentimes kids with low muscle tone, they have trouble with what we call co-contraction. So contracting the muscles that are flexors or our benders, as well as the extensors to kind of be in that upright position. So yes, ma'am. Core stability is a big piece of it too. So any questions about that? I don't think I'm missing anything. That's all right. Okay. All right. On, we'll go to a little bit about breathing and mindfulness. Yeah, I think over. You're welcome. Okay, so we'll tell you about a few little breathing techniques that we do. So one that I like to do, I guess it's about older patients, is a simple little breathing
exercise. And it's where you breathe in for a count of 4, you hold for a count of 4, and then you exhale for a count of 4. And so I'll do it with them. And then once they get used to it, we will include things that, I know about the child. Like usually I'll do, like, whenever I have them close their eyes and envision when they're inhaling, let's inhale the sunshine. Let's imagine that we're inhaling the sunshine. If I know that they love the beach, when we inhale, let's think about sitting on the beach and just watching that water, the waves come in. And this would be for an older child or an adult who knows how to, to do this type of thing. And then whenever they do the exhale, have them visualize exhaling all the stress, exhaling the gook, all the gook in the body, just exhale those things so that you're left with nothing but good things. So I'll often talk to patients if they're able to, I'll talk to patients. So I work with a lot of older patients and a lot of adults as well. And so this is something I'll do definitely with my adults. As we'll have them on the mat. We're working on a lot of the things that we've showed y'all so far. So while I'm doing some passive work, I'll have them focus on the breathing. And so if you have a child or anyone who you're working on, you'd like to try these techniques on, and you can have them, what do they do while you're doing this? You can have them do this breathing exercise, and that will just kind of help it have a better impact. Okay, so let's all try it. Okay, so let's do, we're gonna take a deep inhale for a count of 4, and I'll walk you through it. Okay, so let's inhale, 2, 3, 4, hold it, 2, 3, 4, exhale, 2, 3, 4. Okay, all right, now this time I want you to, we're just gonna do the exhale of the stressors. Okay, so I want you to kind of close your eyes. And when we inhale for a count of 4, 1, 2, 3, 4. Hold it for a count, 2, 3, 4. And let's exhale all those stressors, anything that's bothering us, 2, 3. Okay. And so, so that's just a simple little breathing exercise. Any questions on that? Okay, another one that I like to use with the little ones, or we might use it if you have a group of kids, is just, actually, I used to do this when I was a kid. I had read a book about it, and I guess my parents bought a book on how to put me to sleep, and they would do this with me as a kid, and it would work. So I'm like, oh, it's an oldie but goodie. So really what it is you just, you count to 10. And as you count to 10, you have the child tense up their body, from like, you can do like from head to toe, you're tensing, your head, your shoulders, your arms, your hands, you make a fist, your stomach, your legs, your lower legs, your feet. And by the time you get to 10, you're completely tense, and you're as tense as you can be. And you tell them, so hold on for a second. Okay, and then now we're gonna do from 10 to 1. As we do that, we're gonna slowly but surely just release all of the muscles, and then you just kind of talk them through all of the body parts as you count from 10 down to 1. And then after they get to 1, you're like, oh, that's nice. That felt good. I didn't realize I was stressed out, but now I feel nice and relaxed. So if your child can follow the directions to do this, great bedtime activity, or just a great thing to do maybe at the start of the day to reduce that stress before they go off to school. All right, and then I'll tell you one more little one that I do. I would do this in our groups as well. We used to have calming class. We call it the BEST class, Better Emotional Stability with Therapy. So the BEST class, and I would always do this one during our BEST class. So we would have the kids lay on the floor, lay on their back, or they each get to pick a stuffed animal, and then they have their stuffed animal. They lay on their back, and then we put the stuffed animal on their belly, and then we teach them proper breathing, because whenever you do a proper inhale, your belly should grow, like your belly should go up. So we explain that to them, like, you inhale and, oh, is your belly getting bigger? Oh, good. And then you exhale and your belly should come down. Okay, so we explain that to them, and then we'll put them on the floor, let them lay down with their stuffed animal, and then they get to watch their stuffed animal come up and come down as they breathe. So that's something else to try. Yeah, absolutely.
And I was like, we can use that one too.
Yeah, I know. It's so fun.
All right, so this next one, I'll invite you guys to participate again with me, but you get to stay seated, so no worries, no volunteers coming up in front of class. What we're gonna do is go through a little 5 senses mindfulness activity. And this is one that I kind of talk through with my younger kids, but I use it sometimes myself just as a really good reset to just be like present in the moment and kind of tune out all the extra stressors. So we talked at the beginning about the 5 senses that we consider with calming, and we're going to go through those and kind of bring you guys into the present moment by exploring some of the things that you're experiencing around you. So if everybody doesn't mind, just kind of closing your eyes, and we'll take a second to just really focus on the things that are going on around us. And what we do a 5, 4, 3, 2, 1. So for the first one, I'd like you guys to just kind of, I'm sorry, I told you to close your eyes, but we're going to do 5 things you see first. But yes, thank you for closing your eyes and getting into the moment with me. Okay, so now let's open our eyes. And what I want you to do is just kind of take a peek, around you and pick out 5 things that you see. If anybody wants to call one out, you're welcome to. Red ball. Blue wall. Diffusion. Good, okay. So the next sense we're gonna go to, this is where I like to close my eyes and kind of really tune into it. So let's pay attention to our sense of hearing. Let's have some people call out, see if we can identify 4 different things that we're hearing right now. Air conditioning. I feel like my hearing's a little hyper focused because I was just in the hallway with Mr. Williams in the hall on the phone. You can kind of hear some movement sometimes. People around you. Very good. All right, so the next one is going to be our sense of touch. So 3 things that you feel. I feel like this one sometimes can be tricky, but it's good because it really gets the kid kind of focused in on things that are so I'm going to call out some things you feel right now, or things you're aware of with your sense of touch. Air, yeah. What?
In my shoes.
Yeah. Kind of that sense of grounding. For some of our kids, the sock that's driving them crazy. I get that one a lot. Sometimes the temperature, things like that, will kind of point out. The next one, 2 things you smell. That diffuser is like my best friend. Sometimes laundry detergent or things like that, perfume. Yeah, excellent. Shampoo. Use a lot of unscented things, so I'll get some sensitive once in a while. Hey, this one is usually one that takes a little second, depending on time of day. But bringing it awareness to your sense of taste. I got some gum, leftover breakfast, lunch, good sips of lemon teas, and yeah, so utilizing those senses, especially when a kid is either, overly distracted by things or having trouble focusing, or our worries are just, kind of feeling out of control. Bringing them into the present moment and utilizing those 5 senses and having them kind of talk through what's going on around. And sometimes if, we're not quite in that overly stressed state, or I've had a chance to kind of calm them down, doing that little inventory helps me to figure out what might have been the trigger that set this kid off. If they're in an environment that I'm not quite sure, what may have been the stressor for them. Kind of going into this 5 senses mindfulness activity can be really powerful.
I just wanted to show y'all where you can have, if you're looking for things to buy for, to help your kids. We use a lot of the like mindful cards or calming cards or mindfulness cards. this is just an example, and I bought this on Amazon, and it has all kinds of cute little things that may be appropriate for some kids. You can, like, I'll bring a little activity that it has, like this one is called, it's a writing activity. It's like write your worry down or draw it on a piece of paper or ask a grown-up to write it down. Put it in a safe place, such as a special box or drawer where you can find it again. You don't need to worry when you play, eat, or sleep. You can throw your worry away if you don't need it anymore. So it's like they write their worry, keep it in a little special place, and then whenever they feel like they can let go of it, they can throw it away. And so what a fun little thing that you can do with your child. And if you know that they have a lot of worries, and they could do this type of thing. And there's all kinds of little ones like that. So you can just say, let's do one of our little activities every day. And then sometimes kids might not want to do things if it's their parents' idea, but if you're like, oh, it's not my idea, it's this idea. Like, oh, we have to. Oh, it's on the card, so we have to do it. So you pick one that you like. You can do these. All right, moving on. Great. A couple more things to show y'all. Finished. I'm gonna talk to y'all, I guess, introduce you guys to something called archetype movements. So, and this comes from archetype movements. So these movements are movements that babies do in the womb before their reflexes develop. Okay, so studies were done on movements that all babies do in the womb. Okay, so, and they're called archetype movements. And so there's an archetype class. It's with the reflex integration work, the Muscatova method, and they teach all kinds of ones. But these particular movements have been shown to help children in all kinds of ways. So we'll utilize them in therapy, both actively and passively, so we can get kids to actually do the exercises, and then we can actually get them on a table if they can't follow our commands to be able to do them, and we can help them with them passively as well. So it can be done with kids of all ages, but we're going to show y'all a couple of the active exercises. But before we show you the exercises, I just want to tell you a little bit about some studies that have been done utilizing the archetype movements. The MRI Muscatova method, they have a little DVD with all of the archetype movements. We have a poster in the back of our gym with the movements as well, because we consider them to be that important. There was a study done in Lafayette schools, okay, and it was particularly in the preschools. A teacher was having significant challenges with her students, and they were just having challenges with behaviors. Nobody's sitting still. They're very challenging behaviors. Poor attention and focus. Coordination was actually an issue as well. And so she went to her principal, they got therapy involved. And so the therapist gave her the archetype movement DVD. And they're like, hey, I want you to look at these movements, and I want you to incorporate these into your day with your kids. Okay, so she learned them, and she started doing them with her kids twice a day. So she would do in the morning, and then after transition time, like after lunch, that kind of thing. So it was in August when school was just starting, that she was having these challenges, August, September-ish. And they took the standardized assessments. I believe it's the Dibbles test, and her class scored very low on that. They were, I think 6 of the kids were getting tested for special education. So then they started implementing the archetype movements daily, and she was very compliant with it. By the end of the year, so December, So it had not even by the end of the school year, but fast forward a few months, all the kids' behaviors had improved. They, none of them qualified for special education. Their grips improved, which was an odd, an unusual anomaly, which they thought was just amazing. And they took the Dibbles testing again, and that particular class scored higher than any other class in the whole parish. So the principal came in and was like, "What are you doing?" And like, "We want to repeat this. I want to do this in other classes." And she said, "All I'm doing that's different is these therapists gave me this archetype work, and I'm doing these exercises with these kids and incorporating them into our day." And so the principals hosted or started paying for his teachers to get educated on our archetype classes from that. So it's kind of profound. And then also, we've done a study. It was last summer, I believe. We did a study with, in conjunction with a high school, a student who was doing, what we found, or what the study found, was that cross-lateral movement. So that means movements that cross the vertical midline of the body. Okay, so we were doing some archetype movements and some from another thing called brain gym movements. But those movements actually help to improve math and short-term memory skills by up to 20%. So we give the kids a test, short-term memory, and then also math test, then have them do the exercises, and then we give them a different test of similar difficulty afterwards, and the after tests were up to 20% better. So it's just pretty darn cool. So I've also taught some teachers that are taught to teach teachers that these exercises would be amazing to do before standardized testing to improve their chances of success.
So we'll go through two with you guys today to just kind of teach you. You're welcome to, if you'd like to stand up and join me in these, you are welcome to get moving, feel the differences. For the first one we're going to talk about is called the six-ended star. And so with this one, it involves the whole body. We got arms and legs working. So what we're going to do, I'll kind of demonstrate it first and kind of talk through it, and then we can go through it together, more focused and things like that. So we're going to just spread your feet apart about shoulder width, kind of loosen your knees so you're not locking out your joints, and your arms are just going to come up into extension with your head up nice and tall. Very good. Hold that for a little while. And then we're going to bring ourselves in. We call this starfish and turtle with our little friends. So if you're able to get down, hold your balance there while your arms are crossed. And then instead of holding your head upright, we're going to tuck your chin in. So I say kind of give yourself some love. Hold that for a few seconds. So we're going to inhale. And then as we exhale, we'll move back into the starfish star position. And what I like to do is to tell, I even teach my adults this sometimes, but utilizing this motion and just giving yourself a nice positive affirmation. So I am ready to take on the day. I'm strong. I'm powerful. I know this information. I'm going to ace this test, and then come on down and give yourself some love. Ooh. A good old test of our balance. And I usually repeat that about 3 times with my kids. So very simple. For little ones, starfish and turtles a little more appealing than six-ended star, but that's the technical name for it. Very good, guys. We got one more we'll show you. So Danielle mentioned the cross-lateral movement. So we just imagine that the body has an invisible line going straight through it all the way down, passing from the top of our head through our nose that divides the body to left and right halves. And we know that when we have movement that goes from one side of the body across that midline, what happens is that both sides of our brain are activating at the same time. So this is really important for regulation, attention, coordination, all those things. And oftentimes we see kiddos that come in with a variety of challenges have difficulty with simple movements like this. So it's kind of just the idea of reaching across one side of your body to the other side, but we do an activity called cross crawls. So the most simple way that we can kind of do it is just taking your right hand and bringing your left knee up and just kind of hold for a second. And then we're going to come out of that and we're going to do the opposite. So it's just kind of an alternating movement. I always tell kids, you don't want to rush through it because your brain's got to process what you're doing. For my kids who are really little, I might sit down and do it where they're just touching the opposite knee. And then if you're real good in balance, you can bring that elbow to the knee. I was like, the belly's not quite there. And you can kind of go in that motion. And if you want to get real fancy, we can go in and then do an extension out. Okay. So hold that balance. Good. Okay, so for your older kids or more coordinated kids, things like that, you kind of add that extra function. So that's our cross crawls or cross lateral movement. And we can do these movements several times a day. I like to do them in the morning, definitely just before homework time, test time, those kind of things. If I get the chance to talk to elementary school teachers, preschool teachers, anything like that, I'll say just kind of some marches with the kids before, the whole class can kind of do them together and get that movement going. Absolutely.
When I do these, I feel like I've had a cup of coffee, like,
Yeah.
I just feel so much more mentally alert. It just makes me feel better in my own skin. And so this was also another like prevention exercise to prevent our kids from becoming dysregulated throughout the day. All right, well, I think that's all that the actual information that we have to teach y'all. Does anybody have any questions? Everything. Good. Anything, and no other questions? Okay, wonderful. We'd like to thank all of you guys for coming and thank Families Helping Families for helping us with putting this on and working with us. We wanted to ask you guys if we put a lot of good, or tell you guys we put a lot of good tips on our Facebook page. We're always sharing all kinds of things. So if y'all want to like our Facebook page, that would be
Pediatric Therapy Solutions.
absolutely, yeah. We post all kinds of good little gems and announce things like this that we do for the community. So
So I'm a 2-year-old, and when he gets in a mood, he wants to hit. So how would you it's me or anybody when he gets upset?
yeah, he wants to hit. I would want to know the antecedent, like what's going on before that, and then to look at that. So it's complicated as to why he's doing that. But I would want to see what happened before, and then the scenario for when he's hitting, and then what happens after. And so I'd want to know, just because there's a lot of different reasons why he could be hitting. So I want to kind of I want to analyze that and get to the root cause of why he's hitting. So it's kind of, I think the answer would be it depends, or it's complicated. Do you have any other?
It's just I think figuring out the reason why is kind of the root of where to kind of go from there. But just kind of keeping yourself safe, keeping him safe, and kind of utilizing as quiet or calm of a reaction as you can. We always want to be, as parents, we want to be fixers. And so we want to respond automatically with a lot of words and action, but just kind of, consider those senses, take away as much as you can as far as input to him, and then kind of go into those tactile exercises that could be beneficial.
Perhaps rewarding quiet hands.
Mm-hmm.
Just depending, perhaps rewarding quiet hands. Are we having quiet hands? Good job having quiet hands, or, just whatever is reinforced, whatever, is reinforcing to him. That's what I would say, but we have to kind of look at it to see what happens. And basically, just depends on why he's hitting.
Mm-hmm.
Yes. Anybody else?
What about for an older child who's in the middle of a tantrum, lashing out, screaming? What would you do?
So are they going to stay with you? Are they in the same room as you? Or
Yeah.
they are? Okay. They're screaming? Are they hitting? Or
No, not hitting.
Okay, so if someone is in the middle of a tantrum and an older child, so that's when I would do the senses, okay? I would stop talking immediately, turn the lights down if you can, just stay calm. We call it sharing our calm. I sit and share my calm with the child if they're having a meltdown, even if they're somebody who's older. They may or may not be doing it to get a reaction from a parent. I'm not sure, I don't, but if that is the case, then I would just try to limit your facial expressions. You don't want them to feel like, oh, well, I'm getting something that I like from this or something that I'm trying to get from this. So you just want to kind of limit your facial expressions to something more neutral, and then just try to take deep breaths and keep yourself calm. Okay. And if they see that you're calm, they see that you're not, emotionally reacting as well, it will increase the likelihood that they will be able to calm down. If you're able to get near them, if they're not mad at you, but they're mad at something, then I would come to this. I would stay out of their personal space. I come from the side. I'm not speaking to you. I'm trying to get as far away from you as I can, but I'm going to do some deep pressure right here. Okay. And then if it is soothing to them, you can say, just very minimally, it's going to be okay. Just something along those lines. Does that help a little?
Okay. I think a lot of times she doesn't want to be touched.
Yeah.
That's why I really cooperates.
Yeah.
That's the thing.
Yeah, then don't touch her. If she doesn't want to be touched, especially during a meltdown, then just don't touch her.
And I do a lot of modeling in those situations too, like not giving her eye contact, but I'll just kind of show her that deep breath. And sometimes they start to just imitate what I'm doing. Not necessarily, like, I feel like one of the worst things you can do is walk up to a kid and say, take a deep breath. Kids don't want to hear that. So, but doing more of the modeling and the nonverbal approach. Like Danielle said, just kind of turning your body off, do a little bit of that modeling. Sometimes I'll even kind of start demonstrating either like finger crawls, or if they're kind of, pushing, using their body, just showing them kind of pushing my hands together, pushing into the ground or against the wall to kind of just calm the nervous system, those kind of things, to just kind of give them an idea of an action. And I usually, we tell parents with going along the lines of the nonverbal approach, that the time when they're upset is not the time to teach them. It's not the time for you to provide instruction. If it's not keeping them out of danger by saying freeze or something like that, we just don't need to be talking. And usually, if I'm trying to help a kid name an emotion, I might say, I see that you're mad. It's okay to be mad. It's not okay to hit, things like that. But that's once we're getting, into that calmer state and talking through it after we're back, regulated and things like that. So,
Anybody else? Okay. Don't want to close, or do you want to do it?
Are we gonna redo that?
Yeah, redo the introduction.
Yes, I would redo that. Yeah.
You want to do that? You want to go first? You want to do your introduction first?
Introduction first.
Yeah.
And then,
Yeah.
And then let's
Yeah, suppose.
some of that information.
Do you still want me to?
Thank you.
You want me to turn it off? Okay. There.
Good afternoon, everyone. Thank you again for attending How to Calm Your Child Naturally. My name is Tahara Alexander again. And I am the Empowerment Program Director for Families Helping Families. Dr. Marilyn Thornton is the Executive Director of Family Helping Families in Greater Baton Rouge. And Families Helping Families is a family-driven nonprofit resource center for individuals with disabilities and their families. Our mission is to provide the individualized services, information, and support needed to positively enhance the independence, productivity, and integration of persons with disabilities into the community. Our programs include the Bureau of Family Health, Early Steps, the Empowerment Program, Inclusive Education, the Autism Spectrum Disorder Program, and through Louisiana Development of Disability Council, LACAN, which is an advocacy network. Across all of our service areas, we provide information, referrals, education, training, and family-to-family, peer-to-peer support. Our empowerment program provides families in Louisiana with mental health education, behavioral health education, skills, and resources to increase and strengthen their ability to function successfully. We provide in-person workshops, webinars, parent and caregiver professional multi-support group conference calls. We also have travel stipends to offer financial support to families to attend workshops and conferences. And the stipend covers transportation, hotels, and meals. Please continue to check your email, our Facebook, our Instagram for upcoming events, workshops, and conference participation opportunities. And just a friendly reminder about the upcoming events that we have. The Parent Caregivers Networking virtual meeting is October 15th at 12 p.m., which is virtual online. The Sunshine Social is held October 18th at 6 p.m. to 9 p.m. And the theme is Flannel Frenzy. And it's going to be at the Brett Milton J. Womack Park Ballroom at 6201 Florida Boulevard, Baton, Louisiana. The phone number is 225-272-9200. And once again, Mrs. Danielle and Mrs. Kaci, I'm sorry, were our presenters for How to Calm Yourself Naturally, How to Calm Your Child Naturally. And we'd like to thank them for doing such an awesome job. Great. And we have a survey at the end of the webinar. And please take a moment to answer a few questions, and we greatly appreciate your feedback. And there's also a short survey to take about a few minutes ago. And if you have any other questions, concerns, they can provide in the chat. Correct. And it has been an honor to have you all present, and a certificate of attendance will be granted to all. Thank you.
Congrats on snacks back there.
Yeah.
A lot better.
I think,